To Ignited Minds. So today in my YouTube channel I'm just discussing about the heart. So generally in human beings all of you know that we have a heart of four chambered, but actually directly it had not been formed the four chambered. It had been formed two chambered heart, three chambered heart, and incompletely four chambered heart, and four chambered heart had been formed. So today I'll tell you. For example, let us take a fish, which is an aquatic organism. It has two-chambered heart. In the two-chambered heart, it has one atria and one ventricle. In here, we can see single circulation. Single circulation means the blood enters into the heart only once a time. Then we talk about reptiles, amphibians. They have three-chambered heart. Three-chambered heart means two atria and one ventricle. And in this we can see incomplete double circulation, whereas the blood enters into the heart twice, but the second time halfly it enters, so it has incomplete double circulation. Right side always it carries deoxygenated blood, whereas the left side it carries oxygenated blood. And how this oxygenated deoxygenated blood will be carried, we'll see now. See, towards this right atria there will be some blood capillaries will be opened. This blood capillaries are called as inferior vena cava and superior vena cava. This inferior vena cava gets all the deoxygenated blood from your lower parts of the body, like your thighs, legs, from your foot, whereas the superior vena cava collects the blood from upper parts of your body, like your brain, head, lungs, like this. And this all deoxygenated blood will be sent into the right atrium, and with the help of the ruling or regulation of this tricuspid wall, the blood, deoxygenated blood from right atrium reaches to the right ventricle. Here in the right ventricle we have a blood capillary called as pulmonary artery. And before only I said artery always carries oxygenated blood. Here there is an exception, which is pulmonary artery carries deoxygenated blood, and this deoxygenated blood will reach us to the lungs here, and here they will get oxygenated, and this oxygenated blood will enters into the left atria with the help of again a blood capillary, which is an exception, reaches here. Actually the distance will not this large. What I am drawing is an imagination. So from the lungs, with the help of pulmonary vein, the oxygenated blood will be reached to the left artery. This is the exception, where always veins carries deoxygenated blood. Here it carries oxygenated blood. And from the left artery, with the guidance of this bicuspid wall, the oxygenated blood enters into the left ventricle. Here the oxygenated blood enters into the aorta, and with the help of this aorta, this oxygenated blood will completely circulated through overall of your body. It will be circulated through overall of your body. This is how the circulation takes place. As you see here, the blood entered the heart twice. Once from the superior and inferior vena cava, deoxygenated blood had been entered, and again through the pulmonary vein, oxygenated blood entered into the left atria. As you can observe here, there the blood had been entered twice. So this is called as double circulation. And by using stethoscope, when we hear the sound of a heart, we are going to hear the sound called as lub and the dub. The reason for this sound is the two walls what we learned previously, that is tricuspid wall and bicuspid wall. So the first heart sound, lub, is due to tricuspid wall, and this tricuspid wall will be closed and it makes a first heart sound love. And the second sound dub is caused by bicuspid valve. When the bicuspid valve is closed, the heart produces a second heartbeat sound that is called as a dub. And generally our heart is called as myogenic heart because our heart do not need any external stimuli to contract. It has its own stimuli producer called as SAN node, which is called as sinoatrial node, and we call this as pace setter because so the heart do not need any external stimuli, so it has its only stimuli producing energy producer, which is called as SA node, sinoatrial node, which is also called as pace setter. Now we will learn about cardiac cycle. Previously, the circulation of blood, what we learned, like the blood enters through inferior and superior vena cava, where the tricuspid valve will be open and the blood enters into the right artery, right ventricle. That is called as a cardiac cycle, where your cardiac cycle is of 0.8 seconds. That means for one heartbeat, the time taken is 0.8 seconds. So for 1 minute, our heart beats for 72 times. So 72 times cardiac cycle takes place in 1 minute. Actually, cardiac cycle is nothing but, in this we are discussing the same thing, like how the blood and the oxygenated blood enters towards the right atria, how this tricuspid valve will be open and remain closed. This is your cardiac cycle. That's it. This of the heart. First, most all the people have is hypertension, and generally we call it as BP patient, high BP. So normally when we check a BP, we are going to have systolic pressure and diastolic pressure. Systolic pressure is that when the heart is contracting, that is called as systolic pressure. When the heart is relaxing, then it is called as diastolic pressure. When we will say that it is you have a normal BP, that is 180 by 120 by mmHg. This is a normal blood pressure. Whereas repeatedly, if you have values of 140 by 90 mmHg, then we consider it as hypertension. So what causes a hypertension is the stress what you take makes your hypertension, and due to hypertension many malfunctions takes place in your body. So we always try to maintain a normal BP ratio. And next, coronary artery diseases. See, when on your blood capillaries, walls of a heart, so much of calcium, fats, oils will be deposited. At that time, that disease is called as coronary artery diseases, and the blood capillaries could not transfer the blood through it. So much of pressure takes place, and you may also get the chest pain. That type of disease is called as coronary artery diseases. And the next disease, angina pectoris, where in this disease you have an acute chest pain. Why you are going to get a chest pain? Because oxygen is not transported to your body correctly. Due to that, you are going to get angina pectoris disease. And the last one is heart failure. When your heart stops to beat and it stops to functioning at all, then we call it as heart failure. And sometimes we hear the word called as heart attack, where this is nothing but your heart muscles are not functioning properly. Your heart is functioning, but your heart muscles are not performing well and good. Your blood, like correct amount of blood cannot be pumped. That time it is called as heart attack. And let us have a quick summary very easily. As we said, the square as our heart, right? artery, ventricle, right artery, right ventricle, left artery, left ventricle, tricuspid valve and bicuspid valve, superior inferior vena cava, pulmonary artery, pulmonary vein, aorta. And here you are going to get deoxygenated blood. Here also you are going to get deoxygenated blood. Here you can see some lungs where you are going to get the oxygenated blood here, and it is travel to the aorta and it will be supplied to your entire body. That's it. I think you had understand more about this heart. Thank you.